30-year gentleman, sir. He was a known case of pleomorphic adenoma. Went superficial parotidectomy last.
This was a patient that was operated for pleomorphic adenoma.
Yes, sir.
The histopathology came out to be mucoepidermoid carcinoma. So we took him for completion parotidectomy. And during the completion parotidectomy, we found it extremely badly stuck to the facial nerve. And I think this we shared last time also. This patient had mild facial palsy,
Yes, sir.
which we were attributing to maybe post-operative neuroplexia, or maybe the disease is involving the facial nerve. So the patient was taken up for a radical parotidectomy with consent for the facial nerve sacrifice if it is considered or found to be involved, with possible reconstruction using greater auricular nerve and also the neck dissection. So we used the same incision, right, and we extended it down into the neck to lift up and clear off we sent it for frozen, the lymph node dissection was done. And now the facial was only the segment of facial, especially the one which is the ramus mandibularis and the cervical branch. Yes. They were found to be adherent. So we did that part was removed and greater auricular nerve was placed there as a cable. You can see that. दांत दिखाइएगा. There is a facial palsy and आँख बंद करिएगा, आँख खोलिए. So the rest is fine. He's going to recover. Pathology report has come out to be
only consistent with the
mostly scar tissue, and the nodes are also negative. So we are fine. So in fact, in the first go only we had done a total conservative parotidectomy. So we ended up doing just a part of the the segment of the facial nerve which was removed. So we could get away with it.
So first time we only did superficial parotidectomy.
We did superficial parotidectomy, but in the process we removed some bit of deep lobe also, because it was looking involved. So that is.
It was very hard, sir. The superficial lobe.
The superficial lobe was very hard, so we did almost a total conservative parotidectomy, but we wanted to be very sure. On account of the facial nerve, we were getting a little confused that this could be malignancy. And since the histopathology came out to be mucoepidermoid, we went for the first time there was no facial nerve involved.
Yes.
Now this was done within 4 to 6 weeks, so we are not too sure about the facial nerve, whether it's neuroplexia or it's direct involvement. On table we had to make that decision. MRI did not suggest any direct involvement, but it was involved in the scar tissue. So we cleared of the scar tissue and the facial nerve was set free. I think it will recover now. And that segment which you are talking about, we had used the greater auricular nerve, which by disconnecting and using that cable. So he's doing fine. Hopefully he should be okay.